In March 2014, the Children and Families Act became law. The Act aims to make services better for children and families. It includes big changes to improve services for children and young people with special educational needs and disabilities. The changes must be in place from September 2014. This is the story of how partners in Leeds came together to make these changes happen and make Leeds a child-friendly city for all our children and young people. Before the Children and Families Act became law, the government did some consultation. This was to find out what people thought about the changes. It also gave all the people involved a chance to start getting ready. In Leeds, we needed to learn what the changes would mean for us.
The Children and Families Act is all about improving outcomes and life chances for children and young people who've got additional needs, special needs or disabilities of all different kinds. We've got a lot of children and young people in that category, and what we want to do is make sure that they live the lives they want to lead with as much independence and self-control of what happens as they possibly can.
Right from the start, we knew we needed to have parents and carers involved in making decisions about how the changes would happen in Leeds.
Throughout the whole of the planning and implementation process leading up to the 1st of September, parents have been involved with it almost every step of the way, working together with health, with social care, with Leeds City Council, and it's been valuable both for the Parent Carer Forum, other parents that have been involved, and we've been listened to, and we've worked together on things.
As a parent, it's been great to be involved right from the beginning and to be able to actually influence some of those processes, and also to be able to feed back to other families and so that they can share their opinions and their thoughts. And I know that has fed into different processes and projects.
We also knew we needed to make sure children and young people got to have a say about how things happen locally.
Because at the end of the day, they're the ones receiving the education and they're the ones receiving these services. You know, they have to have a say in it. It's not a matter of they should, they have to. It's absolutely essential.
Because we're like the people who it's going to matter to.
Yeah, that's true.
That are just anybody else, but it's not like they're going to be getting the benefits from it.
Partners across Leeds started to come together. Partners included health services, education providers, social care services, parents and carers.
Within Leeds Community Healthcare, we're really quite passionate actually about the changes and looking forward to being able to work together in a much more effective way.
In March 2014, the Act was passed and it was time to make more detailed plans about how the changes would work in Leeds. We made detailed plans about how to improve information for families through the new Leeds local offer. The local offer will bring together all the information families might need about services.
For me, I think the Leeds local offer will ensure that parents have a much clearer understanding of all the different types of support that's out there for their child, not just educationally, but within health and within social care as well.
The Leeds local offer for us is an extremely good idea because we'd like to make sure that the parents of children with disabilities or certainly special educational needs have the services that they need when and where they want them.
I've been involved in developing the local offer, and I really hope that the way we're going to do the local offer is going to make information available to families to find what they want to know rather than what services think they need to know. And I'm really excited at the potential of working together with our families and with our partner organisations to make this really accessible, available, helpful, relevant information.
We also started to make detailed plans about how the new education, health and care plans would work.
For a long time we've had statements of special educational needs that set out how a child or young person's needs should be met, mainly in their school setting, but also with other aspects of their life as well. We've had those for over 30 years now, and they're going to be replaced with education, health and care plans, which can stretch right from 0 up to the age of 25. That's a big change. I think it's a really positive, helpful change because it puts the child or young person right at the centre and plans around them. And it's very much focused on what outcomes they want to achieve, what they want their life to be like. And then everybody involved with them can help to say, well, what they're going to do to contribute to that actually happening. At the moment, we have 26 weeks to produce a statement, which sounds like a long time, but actually a lot of things have to happen in that time. But families have said, oh, it's too long, we want it to be a quicker, simpler process. So we'll now have 20 weeks to do it, and families and children and young people will be very much involved in what that looks like and contributing to the content of their own plan.
We also made plans for how personal budgets would work in Leeds. Personal budgets can give families with education, health and care plans more choice and control about how money is spent to provide their services.
A personal budget simply says what are the resources we're going to put round a child's needs and a family's needs so they can achieve the outcomes in the plan. And not only on top of that, but families can ask for a direct payment around some or all of the funding and resources that's around that personal budget and that plan.
So with a personal budget, families are going to be able to see what's available in their local community. They're going to look to the local offer and they'll be able to see, because it's in a more user-friendly fashion, they'll be able to see what's available in their locality and they'll be able to use the resources possibly in a more imaginative way than they do now.
By summertime, we were working hard to have all our plans ready in time and prepare for September. We had lots of events and workshops to help everyone get prepared. We started thinking about training for everyone who works with children and young people. We asked young people what is important for them about the people who work with them.
The staff would have been properly trained in exactly that area.
And the teachers are understanding and they know what to do when I get a bit overwhelmed.
On September the 1st, our new Leeds local offer website went live and we were ready to start rolling out the first new education, health and care plans and personal budgets. We hope they will really make a difference to the lives of children and young people in Leeds.
I think it'd be an absolutely fantastic opportunity for us to be working together with the families and thinking about their goals and outcomes rather than us imposing it on them.
I think the changes will really support children and young people moving into adulthood, and it will really enable them to get the support that they need to live as independent lives as possible and really fulfil their potential.
All the partners involved in this work have come a long way together over the past year, but we know there is a lot more work to do and we plan to keep working together in the years ahead.
So there's been an awful lot going on, and it will continue to go on because it is about that ongoing dialogue and working together to make things better. I mean, it won't be perfect because it's that ongoing process of working together.
It's not always been an easy journey, but we're getting there. We've worked together, we've worked through the differences, and once everything comes into play on the 1st of September, we'll carry on with that journey that we're making together and making the whole new system family friendly, listening to the parents, listening to the children, making sure that their views are heard every step of the way.